This is a great opportunity for me to be able to thank many people, many of whom are in this room. I first of all thank my patients who have taught me more than any other groups of folks or any education I could have ever had. I thank my family for helping me stay on the straight and narrow when perhaps I was working a bit too much. I was very fortunate to have great mentors. Dr. Addison Scoville and Dr. Clifton Metter taught me how to be a clinician in the community, but also stay connected to academia, close to Vanderbilt. And finally, Dr. John Surgeon, who helped me in several big leaps in my life. I appreciate what John has done to help me.
Roy has always been a compassionate caregiver. In order to be a compassionate caregiver, you have to be a very, very good listener.
His selfless compassion and determination to help others brought him to look at patients for whom evidence-based medicine, as we're proud to talk about, could not help.
I've really been very fortunate to have had some successes in my career. Thanks a lot to my patients, but also in my work with Alive Hospice, where I served as chairman of the board, palliative care at Vanderbilt, where I helped get our palliative care program started, and finally, and really importantly, is the building of the integrated medicine program that all the people in this room have participated in developing.
These people who can't be helped by pill or surgery are now helped by the Center for Integrative Health that he has brought up almost single-handedly through his collaborative outreach, his deep understanding of people in the midst of suffering, and his knowledge of the limitations of medicine and the possibilities for other therapeutic interventions to be effective. Without Roy, there would not have been this center, and without his optimism and deep understanding of human nature, that this would not have come to pass.
Recently, he has now worked to develop a program of coaching, which is, I think, a very important piece of what we need to do to make medicine better. He also has worked very diligently to take care of mindfulness in medicine and allowing mindfulness and awareness to become a part of how new students take care of their patients.
You know, I have some real simple words for professionals in healthcare. We need to be focused on high touch and high tech. High touch and high tech. But high touch is more important than high tech. Sometimes we get that wrong.
The patients come with some sort of illness or disease, but the main thing they come with is their own story. And Roy knows that listening to the story generously and with soft eyes, he will be able to deliver care that works for the whole patient, not just the disease itself.
One of the most meaningful events in my life had to do with a patient named Georgie. Georgie was my patient for over 20 years. Georgie developed cancer. It was stage 4 cancer, and we all knew that she was dying. One day she called on the phone and said, "Dr. Elam, I want to see you." And I said, "Okay, I can't come right now, but my son and I will come tomorrow." Sure enough, on Christmas Eve, my son and I went to see Georgie, and we walked in the room. She was not her usual jovial self. She was very serious, but she said something to me that is so meaningful. She told me, "Dr. Elam, I ain't had much, but I've had love and I've had forgiveness, and can't nobody take it away." And that really stuck with me, and it has been the mantra of my life, loving and forgiving. That's what I live to try to do.